So I'm coming to you today from the Maxwell Leadership Conference, but I'm coming to you with an issue that I think needs to be addressed, which is you should not have to be an expert as a patient to be able to fight back and to represent yourself with insurance companies. Unfortunately, a friend of mine, Sally Neely-Nix, who is a longtime cancer survivor, multiple battles, but also deals with many chronic conditions, and is a co-founder of We the Patients, is stuck in a fight with her insurance company. The second one of this year. In fact, the first one kicked off at the very beginning of the year, in which Sally was being denied her medication for IVIG, one of her many mental afflictions that she battles every day. Sally's been on this treatment for multiple years, and the payer, in this case Optum, the PBM specifically, was blocking her access to her IVIG because they wanted to do what's called a site review. A site review is very simple. Where are you getting the treatment? It wasn't, do you need the treatment? It was, where are you getting the treatment? And the thing is, for Sally with this medication, if she doesn't get it on time, she'll end up in the hospital completely debilitated. And there was zero effort to rush any appeal of that prior authorization. But Sally's not like every other patient. Sally knows how to fight fights with insurance companies, and she knows how to do so publicly. And because of the work that she had done, we're talking over 20 pages of documentation about why she needs to have the infusion, where she needed to have the infusion, the reactions, the allergic reactions that she's prone to when getting this IVIG infusion, and citing the insurance company's own medical policies back to them. She got the awareness of the C-suite because, as I said, she's very savvy about going public, and Sally put this out on LinkedIn and went after them because, quite frankly, that's all we have left. The insurance companies have gotten to the point where they don't want us spending our money. Let's remember, you're paying premium dollars. They don't want you spending your money because they'd rather that they keep it for themselves. And that's what Sally was up against. And because of her ability to get public, to write, as I called, a dissertation level report to the insurance company, she was able to get the attention of the C-suite, who was able to get that initial denial appealed and got her medication within a couple days of that fight. Unfortunately, she's in it again. Thank you again to United Healthcare and Optum, their PBM. Sally is prone to headaches. Who would have thought? She survived brain cancer, a brain tumor, 4 or 5 times now. She's prone to headaches. And one of the treatments that she's been getting for years helps to reduce the muscle spasm that causes these headaches in the back of her head. Botox, which I also utilized when I was going through chronic pain for my neck, is extremely beneficial for those of us that get chronic headache and chronic migraines. But for Sally, without it, she'll end up in the emergency room with debilitating headaches. But again, Sally knows how to fight these fights. But my question to you is, when is enough enough? Why is it that in today's world of medicine, it's not that Sally had to fight, it's that Sally had to get her provider involved. Sally has to write 26 to 40-page dissertations multiple times to the insurance companies, call them out publicly, of which she's done again, and recently got a phone call from what could have only been the communications department at Optum, who didn't like that she was doing that publicly. But again, why is it that that's the way that this has to be? Why is medicine this difficult to access? Why is the bar so high for us to use the healthcare benefits that we pay for? Enough's enough. But that's why we're fighting with We the Patients. That's why we ask you to join our effort. Go to our website, wethepatients.org, sign up, take the pledge. More importantly, hop into our survey so that we can get a better understanding of the information that you need to know to be better prepared. And on my side, be prepared for what's coming, the Empowered Patient Mastermind. I'm going to help you as a patient better understand our healthcare system, the incentives in that healthcare system. Why are things the way that they are? who gets paid and why do they get paid the way that they do, and how can you best be prepared if a situation like this does pop up to fight it like Sally does. All of it's coming shortly. Follow along. But Sally, keep up the hard work, keep up the good work, and you know that we have your back.